In today's episode of the Buzby Dog Podcast, we're going to talk about my absolute favorite diagnosis to make in veterinary medicine called canine vestibular disease. And I'm going to tell you a story that I think will make it self-explanatory why this is my favorite diagnosis. So picture this. I was a newly minted veterinarian. Literally, I had graduated veterinary school maybe 4 weeks before. And I walk into an exam room and I find Foxy, a 13-year-old blue heeler scheduled as a euthanasia appointment. This poor dog couldn't stand up. If she attempted to, she would just fall over on her side. She had a distinct tilt to her head, and her eyes were scrolling back and forth in their sockets like a typewriter doing sprints. These symptoms had come on suddenly, and the heart-sick owners had no explanation. Foxy had been fine the day before. So the woman held her close, and her eyes were just brimming with tears. The situation could not look more bleak. But me, I strongly suspected. I knew the diagnosis, and I was overcome with glee. I would remember that appointment for the rest of my life. So gently, I extracted Foxy from her owner's embrace so I could perform a physical exam. It's amazing to me how much information can be gleaned from a thorough physical exam. Right? Low tech, no high tech equipment, no expense, just your hands, eyes, and all your senses. But that physical exam told me what I thought to be true. So the somber family was gathering around, dreading my imminent verdict as I wrapped everything up, and they fully expected me to utter, "It's time, there's nothing more to be done." But I had finished my physical exam, I had also done a neurologic exam, and I was able to proclaim, "I have wonderful news for you. Odds are excellent that Foxy will recover from this with little to no long-term effect and continue to live a normal life." I think I even impulsively hugged them. I was so excited. They were in shock. At this point, they couldn't even believe it because it seemed like it was the impossible. So I'm sure you're dying to know the diagnosis, and I did mention it in the title, but we're going to break it down and go into it in depth. And if you have a dog, especially a senior dog, it's an important diagnosis to be aware of. Okay, so drum roll please, da-da-da-da-da. Foxy was suffering from idiopathic vestibular disease, which goes by a lot of names. It's also known as old dog vestibular disease, canine geriatric vestibular disease, and it's so named because it usually strikes dogs in their golden years. Let's break down the word idiopathic. Idiopathic means the origin of the disease is unknown. And veterinarians joke that idiopathic, it starts with IDIO, means the doctor's an idiot and we can't identify a cause. But in reality, in medicine, there's plenty of diagnoses that are idiopathic. We don't know what causes the problem. Vestibular, the next word in the diagnosis, refers to the vestibular apparatus, which is located in the inner ear. This perceives the body's orientation with respect to the Earth's gravitational field, and the information is then communicated to the brain and your eyes and your whole body to maintain and adjust appropriate posture and balance. So symptoms of vestibular disease are similar to vertigo in people. And after experiencing a bout of vertigo a couple years ago, I've developed a new sympathy for these dogs. Towards the end of a busy, normal day, I began to feel so dizzy that I couldn't stand up. Within minutes, I was actually vomiting because the dizziness was so severe. So I crawled to my bed, and just turning my head on the pillow made me sick. So extrapolate that to dogs, extrapolate that to poor little Foxy. Classic symptoms of vestibular disease in dogs include loss of balance. The veterinary term for that is ataxia. It manifests in this drunken sailor gait, abnormal posture, a head tilt, and nystagmus. And that's the medical term for this rapid, uncontrolled eye movement. That's the hallmark of vestibular disease. Just like with vertigo, there is no specific cure. We treat these dogs with supportive care on an inpatient or outpatient basis. So supportive care means we just keep them hydrated, we keep them as comfortable as possible, while the body heals and recovers. So we give them lots of TLC, and sometimes acupuncture can be helpful. So in Foxy's case, she was hospitalized for IV fluids, and I prescribed a medication to treat motion sickness and nausea called meclizine. As part of her workup, we did run what we call a minimum database just to make sure we weren't missing anything obvious. We ran a complete blood panel, which included a thyroid profile, because there appears to be a link, some sort of a link between vestibular disease and hypothyroidism in dogs. And certainly there are other causes for these symptoms, such as infection, including tick-borne disease. So diseases transmitted by ticks could cause symptoms that mimic this. Other options would be cancer, sadly, middle or inner ear disease, trauma, some sort of injury, and toxin exposure. But here's what's classic in this idiopathic vestibular disease that we're talking about. The symptoms are acute. They come on like a lightning strike, and that's exactly what happened with Foxy. And they're non-progressive, meaning that they don't significantly worsen over time. So with a lot of disease, certainly cancer, we're just on kind of a downhill slide, maybe at a different tempo, but we're on some sort of a downhill slide. But with this disease, there's not a progressive element to it. In fact, the symptoms are usually improving sometime during the first 72 hours. Now, full recovery can take 1 to 4 weeks, and that head tilt that they have with their acute symptoms can remain permanently, but often everything else completely resolves. So how do we make that diagnosis? Well, certainly, as I alluded to earlier, a thorough physical and neurologic exam are the most effective place to start sorting out the diagnosis. We've got to figure out, is this related to the peripheral vestibular system, so the ear, or is it related to the central nervous system, which are the nerves in the brain? And idiopathic vestibular disease affects the peripheral vestibular system. So with peripheral disease, as opposed to central disease impacting the brain, we don't see a mental dullness or stupor. So these dogs, even though they're really sick and they feel terrible, they're still alert and bright and are interacting with their people. And we also don't see a generalized weakness. The dog's strength is maintained even though their equilibrium is totally out of whack. For me, I generally feel comfortable making a presumptive diagnosis in the exam room, as I did with Foxy, without advanced diagnostic testing. But I always do throw in the disclaimer that there are other possibilities. We talked about other diagnoses that can look like this. So other diagnoses can present in the same way. And I really can never be sure of the 100% of the old dog vestibular disease diagnosis without ruling out other conditions. And sometimes even a CT scan or an MRI would be the right thing to do. But I think it's reasonable to begin supportive care and monitor the patient when there's a classic presentation. And if the dog improves in a few days, I think that, for me, confirms that diagnosis. And if they're back to normal in days to weeks, so certainly I think that diagnosis of idiopathic vestibular disease was probably correct. If we treat the dog appropriately with supportive care and there's just this continued downhill slide, that's when we have to take more seriously the concern about other options. But in Foxy's case, and in so many cases over my 20-year veterinary career, why it's my absolute favorite diagnosis, we have these dogs that just look so sick. And certainly I'm so sad that they're sick at that time, but they go on and recover quite nicely. And I still recall vividly Foxy's appointment because it was literally the high point of my early years as a veterinarian. And like I said, I mean, don't get me wrong, I was grieved that she was so sick, and I was grieved that the owners were so heartbroken. And it took a few days. We had to endure some rough days. She was hospitalized. I took care of her in the hospital for a few days until her physical condition matched her good prognosis, that expected outcome that I had predicted. But About 3 days later, Foxy walked out of our hospital with her tail wagging. As I said, she had a little bit of a residual head tilt, and that's all that remained as a trace of all that she'd lived through. And then I definitely hugged the owner, who was again crying, just like she was the day that I had met her, but this time they were happy tears. And for me, that was the closest I've ever come to a dog resurrected from the dead. It was beautiful. And like I said, it's just one of my absolute favorite diagnoses to make, because I think my favorite thing as a veterinarian is when you can provide people hope. And in that situation, I was able to provide hope, and God did the rest. Foxy came through and went on to live a couple more years as a farm dog. And she was a healer, so she was very happily living life on a big farm in Pennsylvania. If this is something that is of interest to you, or you'd like to learn more, I want to point you to a resource that I really love and respect. The internet can be a scary place to get information, certainly medical information. There's a lot of bad information and misinformation out there that not only can cause you pain and reading things that may not be true, but can also just deceive you into maybe even going down a wrong path. So this is a trusted resource. It's called veterinarypartner.com, veterinarypartner.com. And there's great information on that site about a variety of veterinary topics. But for this one particularly, if in the search window you type in the word vestibular, 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 you'll be able to read in depth about what we talked about today and other causes of vestibular disease in dogs, with beautiful illustrations and diagrams of the middle and inner ear in dogs. Thanks for tuning in.